welcome back to the channel. Last class we have started with fibro-osseous lesions, in which we have started with fibrous dysplasia. We have seen what is fibrous dysplasia, which gene is responsible for fibrous dysplasia, monostotic type, and how polyostotic fibrous dysplasia occur. Okay, we have seen the gene alteration at the phases. Okay, we'll be continuing with that. Okay, let's start. When the embryo is in the 6th week of development, most histodifferentiation and cell migration have already occurred. ये जो भी defect हम लोग पढ़े polyostotic, Mc Cune Albright and Jaffe वाला, वो सब 6 weeks से पहले हो जाता है. Okay, that have already occurred. If the same genetic defect occurs around this time means around 6 week of embryonic development, the daughter cell will localize to the region and thus may produce the craniofacial type of fibrous dysplasia. Okay, अगर 6 week of embryonic development में हुआ तो it is localized to one region and it may produce craniofacial type of fibrous dysplasia, which involves several contiguous bones in a broad area of the face and skull. Okay, it will involve the skull bones. If this defect occurs slightly later और थोड़ा late, 6 weeks से थोड़ा और late, the daughter cell will be more localized and thus produce monostotic fibrous dysplasia. और ज़्यादा localized हो जाएंगे and it will produce monostotic fibrous dysplasia. Okay. Polyostotic fibrous dysplasia involves 2 or more non-contiguous bones. This form is less common. Okay, polyostotic fibrous dysplasia will involve 2 or more non-contiguous bone and it is more common. Monostotic may involve the skull, jaws or facial bone together with ribs, long bones or the pelvis. Okay, now coming to Mc Cune Albright syndrome. Polyostotic fibrous dysplasia with cutaneous melanotic pigmentation called Jaffe-Lichtenstein's macules and endocrine abnormalities. Okay, Mc Cune Albright syndrome is a type of polyostotic fibrous dysplasia but with cutaneous melanotic pigmentation and endocrine abnormalities. That cutaneous melanotic pigmentation is known as Jaffe-Lichtenstein spots, and the irregular jagged edges of that spot is known as coast of mean contours. Okay, coast of mean contours. Precocious puberty is one of the most important endocrine abnormalities seen in Mc Cune Albright syndrome. Other are hyperthyroidism, acromegaly and hyperprolactemia. These are the endocrine abnormalities. Now, in Jaffe Lichtenstein type, polyostotic fibrous dysplasia with cutaneous melanotic pigmentation in the absence of endocrine abnormalities. मतलब Mc Cune Albright syndrome में endocrine abnormalities होती है, Jaffe Lichtenstein syndrome में endocrine abnormalities नहीं होती, but both are the types of polyostotic fibrous dysplasia. Coming to craniofacial fibrous dysplasia, it involves 2 or more bones of the jaw midface skull complex. Once again, craniofacial fibrous dysplasia involves 2 or more bones of the jaw midface skull complex in continuity without Jaffe-Lichtenstein macules or precocious puberty. So Jaffe-Lichtenstein macules are the peculiar features of Mc Cune Albright syndrome, or it is may also be seen in Jaffe Lichtenstein syndrome, but the Jaffe-Lichtenstein spot is known, or it's the characteristic feature, or the term is given for Mc Cune Albright syndrome. Okay, this type of fibrous dysplasia is seen relatively often in dental and oral maxillofacial practices. Craniofacial dysplasia is common in maxillofacial practices. It is frequently thought to be a monostotic fibrous dysplasia of the maxilla, yet it often includes the zygoma, sphenoid, temporal bone and nasal concha. Okay, that's all for today. We'll be continuing fibrous dysplasia in next class. Till then, like, share, subscribe and comment. Bye.